We've been in the funeral business, at least we've been at Eagle Hall for at least 32 years with Dunks and Wilson. Prior to that, I operated Wilson's Funeral Home, which was in Government Hill. And we worked out of Tudor's Funeral Home then. So we've been in the business for at least almost 40 years. I'm a trained embalmer. When I went to a mortuary school, which was in the late 70s, the first thing they taught us is handle every case you're dealing with as though it can be infectious, as though it can create problems. They taught us about sanitation, and it taught us about care in the things we wear and the things we do. Never take for granted that he or she just died from old age. You should always take it for granted that there may be a suspicion in the cause of death. And because of that, one should always be very careful working in the mortuary. Being careful is that we should wear gloves, we should wear masks, we should wear personal equipment, which is the PPEs as it's called now, and use things like Clorox. And Clorox has always been good, and it still is good. It was good for AIDS, it was good for other things, and it's good right now. Our staff, thankfully, they've been with us for a long time, and they know how it is the best way to deal with such cases. Even going to the hospital, bringing someone who's died from, we don't know what they died from, going to people's houses in case someone died as well. People do die at home. We take care in that. So we always are very cautious and very professional in the things that we do. Well, when I first heard about novel corona, which is a new corona, as they've had many others in the past, I said, here we go again. Another virus in the world. As you know, it's not the first one, and it's not going to be the last one. There was SARS, there was Ebola, and this one, which is the newest one, which is called now COVID-19, has become a very dangerous one in that has affected the whole world. It has made things quite different, and it's changed the way we live and the way life is for us. Okay, once upon a time in Barbados and all over the world, there was something called AIDS. AIDS was the big fear. Everybody was scared about AIDS, AIDS this and AIDS that. And let me go and see he or she that died from AIDS. They even pushed down coffins, stood from a distance, through ignorance in many respects. We did a lot of AIDS cases, and I did them myself personally. But the point is that the whole world was scared of AIDS one time. But now they have AIDS cases, AIDS funerals, etc., and nobody really cares or nobody notices. It doesn't, it doesn't faze people anymore. I think the same thing will happen with COVID-19 eventually. Funerals these days, because of COVID-19, and because we have to protect ourselves from each other. The law is, not just Barbados, but the policy is that if someone dies, it was before, 10 members of the family could attend. Luckily for us, it's gone up to 20 members of the family. And it's important that we understand the reason why. There's something called human-to-human contact. We pass on things as human beings to each other. That's why we must stay away, and that's why the policy is stay home. Yes, it is can be difficult explaining to families, but I think when families realize it's either we go to the funeral or we have hundreds of people and we die, or we stay away and only the family can go. I'm sure that the families do understand, although it's sad. I mean, they have relatives in England, in America, all over the world who cannot attend. That's why these days we have simple graveside funerals, and we stream the funerals in that. If you go into the church, if you're allowed into the church, you have 20 members, and then you can stream it and let the people in any country see what was done. Streaming is nothing new to us. We've always done streaming because there have always been situations where relatives abroad want to see the funeral live as it took place. Cremation has increased in Barbados, but cremation has increased worldwide as well. Some people think that cremation is the cheapest thing to do. It may not be. For example, an earth burial at Westbury Cemetery or any government cemetery may cost you, for the grave alone, $500. Whereas for cremation, you can't just take someone and just cremate them. Cremations, the basic cost of a cremation is approximately 3,000 Barbados dollars. So it's a little more expensive. You know, I want people to understand that under normal circumstances, there are two ways of disposition, which is the earth burial or cremation. But with cremation, in lots of times, people still have the same thing, the same church, the same service, the same obituaries, etc. Our son, his name is Dean Wilson, he works at a funeral home in New York. He does embalm the COVID cases. And there's so many in New York, it's unbelievable. But they have so many, those cases now, that most of the funeral homes have stopped taking them. Oh, we take our guidelines from the Ministry of Health, also from the Centers for Disease Control, and from the World Health Organization. And we follow what's happening with other funeral homes in America, in England as well. And that's the way we have to do it. We have to do what the international regulations are. My feeling is that the scientists will develop a vaccine within another few months. And after the vaccine is developed, as there was a vaccine for measles, as there was one for mumps, as there was one for TB, the world will become as it was almost before.